Happy second week of trying to learn how to learn online. This PowerPoint is going to be over Chapter 20, Diseases of the Nervous System and the Eyes. And so hopefully you've had a chance to go through the skin, and we'll talk about the nervous system and the eyes. This will be fairly short. So how do infectious organisms get into our nervous system? Since our nervous system does not have normal microbiota, it's called azenic. And so if they get into the nervous system, it's usually through breaks in the bones, the meninges, sometimes through medical procedures. Sometimes they get into the peripheral neurons and then they travel up to the central nervous system. Sometimes they can get through the meninges, causing meningitis. And then anytime you have an inflammatory response, then the blood-brain barrier can be changed, and that could allow virus or bacteria into the brain. So usually what we see is meningitis or leprosy. I'm not going to see leprosy in the United States except maybe in the leper colony. And then bacteria growing that release toxins, and these toxins will then affect the nervous system. And so that'll be botulism and tetanus. Bacterial meningitis is probably the most common type of meningitis that we see. What we know is that has a sudden onset of high fever, severe inflammation in the meninges, and then there is a white blood cell count in the cerebral spinal fluid. And if you'll remember correctly, the cerebral spinal fluid should have no cells in it. The body's response via inflammation causes most of the signs and symptoms. The infection of the brain itself, the brain tissue itself, is called encephalitis. And this can be a byproduct of bacterial meningitis. Encephalitis, you could see coma and usually death. Bacterial meningitis develops very rapidly. So what are the 5 species that cause bacterial meningitis? Neisseria meningitidis, Streptococcus pneumoniae, Haemophilus influenza, Listeria monocytogenes, and Streptococcus agalactae. You'll remember Listeria from the bluebell debacle a couple of years ago. Streptococcus pneumoniae can travel from the lungs via the blood system, the circulatory system, and infect the meninges and even the brain tissue itself. So let's look at these. Neisseria meningitidis is a gram-negative cocci. Its virulence factors include Vimbriae capsule and a lipooligosaccharide. So when the cocci have these type of attachments, then we see they can stick to the cell and they can trigger fever, inflammation, shock, and clotting. Streptococcus pneumoniae is a gram-positive coccus. Notice it's the leading cause of meningitis in the very young and the very old. What does this tell you? You're right. It has it's able to proliferate in people who have who are immunocompromised, In children, we're thinking about their immune systems just aren't quite developed yet, and in the elderly, then their immune systems are dying off. It is capsulated, so that prevents phagocytosis. It produces enzymes and toxins that can fight off the immune response, and it has a protein, really it's a surface molecule called phosphorylcholine, and this will trigger the normal cells to take up the Streptococcus pneumoniae. You don't want that. So here we see Streptococcus pneumonia. Haemophilus influenza does not cause the flu. This is a bacterial infection. Notice it's an obligate parasite, which means it has to live in humans in order to reproduce. It does have a capsule that helps prevent phagocytosis. Most of the disease is caused by Haemophilus influenza type B. We have a vaccine to that, and so most of the time we're not going to see Haemophilus influenza meningitis. So here is a picture of Haemophilus influenza. Notice that they do have some flagella. Looks like a lot of these flagella had broken off. But they're pleomorphic, which means they have different shapes. But most of the time they're rod shaped. Listeria monocytogenes is a gram-positive rod. A coccobacillus means that it's a very short rod. It comes in, we ingest it. In most of us, it is not pathogenic, but it can cause meningitis in those whose immune systems are compromised. Pregnant women, fetus, newborns, the elderly, people who are on chemotherapy, radiation therapy, have autoimmune disease. This is a problem. The production of a protein called Listeria lysine O, and notice that the end lysine, which means it's going to cause cell lysis. And so this protects it from being phagocytized. And then we have Streptococcus agalactae. This is normally found in the vagina in some women, not all. The capsule allows the bacteria to evade phagocytosis, and it can cause bacteremia, pneumonia, and meningitis in newborns. It can cause a major problem with newborns. When we look at this, most of the time when we see it in newborns, they've gotten it from their mother. Listeria, once again, contaminated food, and the others are transmitted by respiratory droplets. Are you beginning to understand how so many diseases are transmitted by respiratory droplets? Usually the bacteria will become bloodborne, and once they're in the blood, then they can very easily find their way to the meninges. Sometimes getting hurt in an automobile accident or getting hit in the head, this kind of trauma can allow the bacteria to enter into the meninges because the meninges are broken or torn. Haemophilus influenza was the leading cause of bacterial meningitis before people started vaccinating. S. pneumoniae and N. meningitis are the most prevalent. S. agalactae we know is found mostly in newborns. None of these are really spread by casual contact. Someone has to be ill and cough on you, sneeze on you. Okay, how do we diagnose this? Mainly on signs and symptoms, and then culturing the bacteria from the cerebral spinal fluid. You're going to have to treat with intravenous drugs, mainly because oral drugs take too long to get where the bacteria is. So put everything in an IV, it shoots through the circulatory system, and it gets to where it needs to be very, very rapidly. Notice that we have vaccines for 3 of these, and then if a baby has Streptococcus acalactae, they can be given penicillin. And then if your immune system is not at its very best, then be careful about what you eat. Try to avoid listeria. So those were the bacterial diseases. Let's look at bacterial toxin diseases. What we're seeing in botulism is that this is an intoxication. Intoxication, that means toxins are produced. And there are 3 types of botulism. You had foodborne, and this causes progressive paralysis on both sides of the body, and this can be very deadly if it's left untreated. Infant botulism, and so this results from the spores getting into the GI tract. Usually there are non-specific symptoms. And then there is wound botulism. And so what has happened is that somebody steps on something, they get a deep wound in their foot or maybe their hand, and the spores, the endospores, this is Clostridium botulinum, the endospores get into the tissue, and then they start putting out toxins that are going to kill the normal tissue, cause it to be dead tissue so that the bacteria can survive. So Clostridium botulinum is a causative agent, gram-positive bacillus that forms spores. It's found everywhere in the soil and in the water, and there are up to 7 different neurotoxins. So about 60%, about 60 cases of foodborne and wound botulism per year in the U.S., and infant botulism is most common form in the U.S. This is not good. So basically what the toxin does is that it blocks the nerve from releasing acetylcholine. And so no acetylcholine, and you have, right, you're going to be able to contract the muscles. No. Okay. So when we look at this, you're going to diagnose mainly by signs and symptoms. You have to make sure that the airway stays open. You may have to wash the intestinal tract to remove all the Clostridium. Administer botulism immunoglobulin, and then treat with antimicrobial. Also, with wound botulism, you can use hyperbaric chambers and try to force oxygen into that dead tissue area. Since these are anaerobic bacteria, oxygen is deadly to them. So since bees buzz around and they land on the ground, they can pick up Clostridium botulinum spores and then take it back to the hive, and it incorporates into the honey. Because it is so deadly on infants, this is why we say don't feed infants under 1 year old honey. Pasteurized honey is going to be safer than raw honey, but it's probably best just to be on the safe side, not to give infants 1 and younger honey. Wait until they're 2. Another toxin that affects the nervous system we call tetanus, and you've all had your tetanus shots. We did not give you tetanus. We gave you the toxin in a form that wouldn't cause problems so that your body would prepare antibodies to the toxin. This was called lockjaw. And basically what happens is that the muscles contract, but they don't relax. And so it spreads, and you get you can have such strenuous contractions that bones will break. This used to be called break bone fever. Clostridium tetani causes the disease tetanus. It's found everywhere. It even grows in our guts. And the name of the neurotoxin is called tetanospasmin. Tetanospasmin causes spasms. That makes sense. Here's a baby who has tetanus, and you can see the muscles have contracted and aren't releasing. How do we get Clostridium tetani? Well, quite basically, when you have any kind of break in your first line of defense, then the endospores are all over the place. You know, we used to say rub dirt in it. Please don't. You'll get endospores from Clostridium in your wound, and this is not good. Notice in tetanus how far away the infection is from the central nervous system determines the incubation period. So if you get it in your foot, then it's going to take longer to show signs of disease than, let's say, if you puncture your hand. If it's left untreated, 50% of the patients will die. Because we do have a vaccine against the toxin, then we've seen a decrease in the incidence of this disease. Most of the places where you're going to see this is when they're places that do not have adequate health care, neither do they have a vaccine. Basically, it's diagnosed on muscle contractions. Well, by the time that's happening, it's not good. How do you prevent it? Well, get the vaccine. How do you treat it? Make sure your wounds are clean. Use immunoglobulin injections. Do have antimicrobials that you can give IV. And just, vaccinate, vaccinate, vaccinate. This is a good point to take a break and stretch. Go back over your notes. See if you have any questions. If you have any questions, please email them to me, and I'll be happy to help you. So draw a line in your notes and label this section viral diseases. Because viruses are so very small, they can cross the blood-brain barrier much more easily than bacteria and fungus. And we're going to look at meningitis and polio. I'm going to skip over rabies. So let's get started here. Viral meningitis, we're going to see the same signs and symptoms. The only thing is that in viral meningitis, you probably won't see very many neutrophils, but you may see lymphocytes in the cerebral spinal fluid. 90% of the cases are caused by the genus enterovirus. Okay, that's an RNA. And then Coxsackie-A virus and Coxsackie-B virus, echovirus. So these are enteroviruses. What is this? Entero means in the gut. And so basically what happens is someone is shedding the virus in their poop and food, water, or even on their hands. So we can see this a lot more often in areas that do not have adequate waste disposal. They don't have clean water. And this is why we have everybody wash their hands. Once it gets into the small intestine, it's absorbed into the bloodstream. It can go to other organs, but winds up eventually in the meninges. So, of course, you have an inflammatory response. This can also be spread by respiratory droplets. And then once again, you're going to diagnose looking at signs and symptoms and basically not finding bacteria in the cerebral spinal fluid. The best way to treat this is with supportive care and try to keep everything clean. Do your best to make sure everybody washes their hands. The second type of neurological virus is poliomyelitis. And this used to be a very common epidemic that would run through cities or states or communities. If we keep working at it, trying to get everyone vaccinated across the world, maybe we can eradicate it. 90% of the cases are asymptomatic. Then we have we have minor polio. There are non-specific symptoms. Non-paralytic polio, where there are muscle spasms and back pain. Paralytic polio produces paralysis. And then we have found post-polio syndrome in patients who had polio as a child. They may have a second infection from the virus staying in their system. But it can be just as nasty, if not worse, than the initial infection. Poliovirus causes this, and mainly what we see is the virus is shed in the feces. Feces is found in the water. People drink the contaminated water, and lo and behold, you have nasty, nasty polio. Here is a woman and an iron lung. This is, you can tell by looking at the picture, is quite old, but her muscles have been destroyed by the polio virus, so she can't breathe. And what the iron lung does is that it forces pressure on the chest and causing exhale, and then releases it, causing inhalation, and it's tough. Most of these patients die from pneumonia. Here we look at where do we see the largest number of cases. And you notice in 2002, India had massive polio infections. And the Indian government decided, we're going to vaccinate everybody in our country. And they did. Between 2002 and 2015, they went door to door and gave everybody a vaccination whether they wanted it or not. And now you see in 2016, wow, no cases in India. That is absolutely amazing. Absolutely amazing. What you also notice is that the New World, North America, South America, Central America, are not on this map. So it helps immensely. Vaccines will eradicate disease if we give them a chance. Diagnosis is identification of the virus in the throat or the feces. You can do a throat swab and test for the viral nucleic acids. There are no specific treatments, but there are two very effective vaccines. So we have the SALT vaccine, which is an inactivated polio vaccine, and the Sabin vaccine, which is an attenuated oral polio vaccine. You can read there the advantages and the disadvantages. I've had both because of my age. We were all given Salk vaccines, and then as I traveled overseas, I was given the Sabin vaccine. All right, here's a good time to draw a line in your notes, get up and stretch. We're going to talk about fungus in our central nervous system. So pause and stretch, look at your notes. I hope you had a good stretch. So let's look at fungus in our central nervous system. Not good. Mainly, we inhale the fungal spores into the lung, and then fungus begins to grow, and they cross the barrier into the circulatory system. Mushroom toxins, yeah, don't do that, guys. They produce nasty side effects. Very rarely you will see fungal meningitis, and usually you will see this only in people who are severely immune compromised, HIV, for example. So cryptococcal meningitis is caused by Cryptococcus neoformans. Cryptococcus neoformans, and they can resist phagocytosis. Sometimes with this you see loss of vision and coma, but it looks a lot like bacterial. So how do you diagnose it? Basically, you don't see any bacteria in the cerebral spinal fluid, but you can detect fungal antigens in the cerebral spinal fluid. So that's all we're going to talk about fungus among us. So let's talk about protozoans. We're not going to really look at these. The two basic ones are African sleeping sickness, which we don't see in the New World, and meningoencephalitis. That's how you say it, meningoencephalitis. And so here we have an inflammatory response of the meninges and the tissue of the brain. The next thing we want to look at are prion diseases. And remember, these are infectious proteins. And we think about, scrapie and mad cow disease. This is called spongiform encephalopathies. I had to practice that. Spongiform encephalopathies. And mainly what that means is that your brain looks like a sponge because it's got big holes in it. Very rarely can a human get this by eating meat from infected cattle. Usually it's only those people who suck the marrow out of the bones, and they are immunocompromised to begin with. One of diseases is called variant Creutzfeldt-Jakob disease. and we see that people who have this have insomnia, weight loss, memory failure, and then they start losing control over their voluntary muscles. It is caused, of course, by the abnormal form of the prion protein. It's called VCJD. That's the name of the disease, and that's the name of the prion. And it can occur in anybody. Basically, you diagnose with signs and symptoms. There's no treatment. You can't destroy it. Destruction of prions outside the body doesn't occur. So what do? You just make sure you don't eat any contaminated meat. If your cow has spongiform encephalitis, shoot it and bury it or burn it. All right, the last thing we're going to talk about are microbial diseases of the eye. And when we look at this, remember what the eye looks like. Pay attention to the cornea, the conjunctiva, the retina. Maybe we've all had conjunctivitis because of allergies or whatever. But what you're going to see in the United States is blindness caused by trachoma, chlamydia trachomatis or trachomatis. And it multiplies in the conjunctiva. It causes this pussy discharge in the eyes, and we see it. It can scar up the cornea, and the scarring can lead to blindness. So here we have the little pus packets in the eyelid. Yeah, stay away from chlamydia. Not happy, not a happy place. So, not good. Basically, you can diagnose by getting bacteria from the site of infection. You treat it with antibiotics. Sometimes surgery can correct the eyelid malformations. Might be able to correct the cornea. It's hard to tell. Other microbial diseases, you can think of any kind of bacterial infection of the skin or reproductive tract can affect the eyes because people are constantly touching their eyes. Remember we talked about styes when we talked about the skin, so that the sebaceous glands near the eyes get infected, and that can people can then rub that and pop the bacteria into the eyes. Ophthalmia neonatorum, wow, is the inflammation of the cornea and the conjunctiva in newborns. Conjunctivitis is inflammation of the conjunctiva, and keratitis is inflammation of the cornea. And these can be caused by viruses, they can be caused by bacteria, sometimes by protozoans, fungus. If your patient has a fungal infection, their immune system is very compromised. So that's a problem.